last-minute shakeup at 5:30 a.m., laundry situation not good. And when your focus is on helping your clients, it's easy to forget about yourself. But NASM knows trainers.
Morning ride is okay.
And staying in front of the day isn't always as simple as 1, 2, 3. So when the unexpected has you pressing pause,
what's the latest on creatine?
I'm going to get back to you on that.
let NASM1 help you press play. Visit NASM.org to sign up for a membership today.
Hey everyone, welcome to Strong Mind, Strong Body. Today we are going to talk about a topic. Okay, are you ready? Shh. We're going to talk about why you pee your pants and tips to take control. We won't tell anyone else that we're talking about it, but let's you and I sit down and have a chat about it. So we're going to tackle this topic that no one really wants to talk about, but everyone probably needs to hear. So in this episode, I have occupational therapist and wellness coach, Kim Mills. She's going to break down why it's actually really common that a lot of us suffer with bladder leaks, whether you're lifting weights, you're running, or you're just going about your day. And more importantly, how do you regain control without invasive treatments? So Kim's going to share some practical, simple exercises, lifestyle tweaks, and maybe some sustainable habits that will deliver real results. So whether you're a gym person or you're not a gym person, or you're a fitness professional or a wellness coach, or just an everyday person who is like, wait, I want to hear about why I pee my pants, then this discussion is for you. So I'm going to bring in Kim and have her introduce herself. How you doing, Kim?
Hi, Angie. I'm doing great. Thanks so much for having me. I'm so happy to be here. So yeah, I'm an occupational therapist. I've been an OT for going on 33 years now. And about 15 years ago, I got interested in pelvic health, primarily regarding bowel and bladder control. And that was because I was seeing such an issue with most of my clients. So many of my clients had issues with control. So, and then more recently have gotten into health and wellness coaching. And so hoping to really reach more folks that are having issues with control through coaching.
Yeah. And I think that's important because there's not a lot of people out there. And I know that you differentiate because you say that you're not a pelvic floor specialist. You're talking about, other ways that you can manage bladder and bowel leakage. But today we're specifically focused on bladder leakage. So I feel like a lot of people feel embarrassed about bladder leakage. And yet I think it's pretty common. I know that for most women, after they've had a baby and they go and do any kind of impact work or heavy weightlifting, I don't think it's uncommon. So, you don't have to give us like hard, fast stats, but is this pretty prevalent? And why do so many people suffer silently?
It is quite prevalent, actually. I saw a recent statistic that said more people will have issues with bladder control than having diabetes or heart disease combined. So it's quite prevalent, and over half of all women will experience some form of incontinence in their lifetime. And it typically takes like 6.5 years for women to actually see their physician regarding it and get an actual diagnosis.
Okay, I might be a little depressed right now. I was like, wait a minute, I wasn't expecting it to be that dismal. Hold on, we need to stop the show. Okay, so could you walk us through the most common causes of bladder leakage that you see in your practice? Please tell me it's something simple, low-hanging fruit that I can get rid of.
Okay, so there's a couple of different kinds that I see. The most is stress incontinence, urge incontinence, and mixed incontinence. And mixed incontinence is a combination of stress and urge. So to give a little rundown on the differences, stress incontinence is when you have intra-abdominal pressure. So that's pressing on your bladder and causing leakage. And so that could be anything from coughing, sneezing, a heavy lift or a high impact exercise. For an older adult, it could be just rising from sit to stand if it's effortful, that can bring on leakage. So urge incontinence is more about your bladder being overactive or overreactive to things like a trigger or an irritant. And so different triggers might be running water, hearing running water. Could be if you've been out running errands and you get back into your drive into your garage and all of a sudden, oh my gosh, I've got to get into the house right now or I'm going to leak urine. That's a really common trigger. Some other triggers, surprising triggers, could be walking into a cold room. Also just everyday tasks. If you pair that task with using the restroom, it can become a trigger. So I'll give you an example of myself, actually. So I found that for quite a while, I was in the routine of using the bathroom right after I brush my teeth at night. And so all of a sudden, I'm having urgency while I'm brushing my teeth. So I really had to look at that and break that pattern in order to get rid of that urgency.
Yeah, that's an interesting one because I wake up about 200 times a night, half awake getting here. And my mind says to go to the bathroom the minute I wake up. And I've been trying to break that habit of just because you wake up doesn't mean you have to go. But for some reason, my mind says that I do. And so I get that 100%, that resonates with me so much. And then the stress incontinence, things like you said, like coffee, heavy lifting. And then just the urges where it's almost like you're talking about, it becomes mental, where you associate almost like habit stacking, where you associate one thing with another thing. And it's crazy how much the mind gets involved in this. Right?
Exactly. And the more you worry about it, the worse it gets. Yeah. So, and I did just have a recent client who, as another example, so would go to the swimming pool for exercise, swim laps, and then started noticing urgency when she was walking from the swimming pool to the locker room, because what she would do is immediately go into the locker room and use the bathroom. So pretty soon she's walking from the pool to the locker room and she's leaking urine, and she worried about it and became more and more stressed about it. And it just got worse and worse. So we really worked on some strategies around that, and she's much better.
So are you saying that, Kim, a lot of times it is really very mental, like we have to change our habits, almost like I said, like habit stacking. So we have to change the association patterns that we're making in our mind?
It's a lot of just behavioral modifications, lifestyle changes play a big part in just really kind of working on that relaxation part too. Anxiety and stress really plays a huge role in this.
Well, it's funny. My daughter and I are planning a trip, and we looked at one of the tours, and the first thing that she and I noticed in the fine print was that there wouldn't be restroom facilities. And I was like, I'm out. And she goes, I'm out. And it was just so funny. Like, obviously big age difference between both of us. And we're both like, yeah, nope, we're not getting on a bus where they say you can't have a bathroom, because the minute somebody tells me the bathroom's out, I really have to go to the bathroom. So, Kim, you take a different approach from traditional pelvic floor training. Can you explain like what those key differences are, like the differences in your coaching method and how you find it to be more successful or just more effective for long-term success?
Sure. So first, I want to say that there's definitely a need for pelvic floor therapies, in-person therapies, and especially for more complex conditions. But as an OT working in pelvic health for a number of years, I found that I was providing a lot of education, especially around behavior modifications and lifestyle changes, and just really working on routines, changing routines, breaking those habits and things like that. That's really what made a difference. And so as a coach, I feel like that's what I can really focus on the most with my clients. And in addition to that, I also find that when folks have other health concerns, other health and wellness issues, that can exacerbate the pelvic floor dysfunction. And so as a coach, then I can also help with navigating those wellness issues, working on overall wellness to help with that, as in addition to the control issues.
Yeah. So really what I hear you say is the theme keeps coming back to there's a lot of behavioral stuff that you can correct. And so yes, 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 there is definitely a need for a pelvic floor specialist, especially for
Hmm.
more like chronic issues and severe issues. But what the kind of clients that you're seeing, it's very much behavioral driven and kind of habit based driven and looking at what are we doing in our mind or what are we creating in our mind, what kind of patterns and how can you break those patterns. And so it's almost
Hmm.
like behavior modification, and we know that's very effective. So let's start to give some secret sauce. Okay.
Okay.
You don't have to give away all the goods, but I mean, let's give some secret sauce. So let's get kind of practical here. What is a simple strategy? So let's go back to the okay, I wake up 20 times a night. All right. Every time the minute I wake up, my mind says, you better go to the bathroom.
Hmm.
And then my other mind, don't know if you know, I've got two or three. Most of us do, right? We've got these things called parts, and part of us says you should go to the bathroom, and part of us says, no, you shouldn't. It's going to wake you up. We've got these
Hmm.
things called parts. I do a lot of parts work with my clients. So, what do I do with that part that is banging on my door saying you need to get up and go to the bathroom? What's a practical strategy I could implement?
Hmm. Okay, sure. So getting up more than once per night is really considered abnormal, I guess. So once per night is considered normal. So really looking at some things like what you're having to drink before you go to bed, maybe kind of tapering down your fluid intake before bedtime, and then just really looking at when you wake up during the night, you've probably gotten yourself into a pattern of over the years of when you did wake up, you were like, oh, I might as well just go to the bathroom because I'm awake. And so when your bladder wasn't full, right? And so just kind of assessing whether or not your bladder is full. And so thinking about that when you wake up and then trying to just stay in bed, relax, practice some urge suppression. And so some urge suppression techniques are doing like 5 or 6 quick Kegels, quick pelvic floor squeezes, because what that does is it sends a message to your bladder to relax. And you can do that in bed, do some squeezes, and then really work on relaxing and getting your mind off of the bathroom, which can be really challenging in the middle of the night, as we know. And then just trying to eliminate like one bathroom trip at a time, right? So if you're getting up 3 or 4 times, I've had clients that get up, oh my gosh, 7 times a night. Let's eliminate one time, and then we'll move on to the next time, and really try to get some control over that.
Yeah. Well, here's one. I'm going to throw something at you that I find kind of interesting. For and I know these drinks are very, very popular, right? I'm not going to name the brand, but there is a drink of magnesium, and you drink it before you go to sleep, and it will help calm you. And got some good ingredients in it that are organic ingredients that help calm you and help you sleep. Well, my
Mhm.
mind says drink it right before you go to bed, but I drink it with 8 ounces. And
Mm.
the urge to go is really strong throughout the night, more than once. And when it happens, I'm always like, this is way more than 8 ounces, the amount of times that you're getting up. But what do you
Mhm.
recommend with those kind of drinks? Because they're very popular. How soon before you go to bed should you be drinking them?
I would say to cut it out like 2 hours before you go to bed. I would not take those drinks within 2 hours. So that's typically what I tell all my clients. So hydration, if they're getting their hydration in through the day, I always let them know, okay, get the most of it in the early part of the day, and then really start to kind of taper it. And clearly people have to take medications and things like that at night before bed. So just try to take sips. So as far as those kind of drinks, yeah, I would feel like that might pose a problem if you're drinking 8 ounces just before you go to sleep.
Yeah, that's the thing. The goal or the intention is that it makes you tired. It
Hmm.
brings you down. And so if you do
Hmm.
it 2 hours before you go to bed, you might just pop off and go to sleep 2 hours too soon.
Right.
So therein lies.
Maybe just sipping it and taking less or taking more time to kind of get it in. So the more we gulp or drink quickly, we'll have more urgency as well.
Yeah, I think that that's a really good point right there is slow it down. And maybe
Mhm.
also don't drink it with 8 ounces. If you can drink it with 4
Mhm.
ounces, yes, it'll be more potent, but you're
Yeah,
taking
take
in
half
less
of it.
liquid. So I like that. So for fitness professionals who are
Mhm.
listening, what are some signs that they might look for in their clients that might be struggling with incontinence? But maybe the client doesn't want to mention it or the fitness professional doesn't want to mention it. How
Mhm.
can they sensitively approach this topic?
That's a really good question. So they might notice that their clients are hesitant to maybe increase weight for a certain exercise for fear of that intra-abdominal pressure and leakage. Maybe their client is using the bathroom between sets or between exercises because they're like, okay, I got to keep my bladder as empty as possible so that I don't leak. So those are some things that they might notice. As far as what they could do, I think it would be great for fitness professionals to incorporate some training around pelvic floor engagement with their training program. That could be as simple as on an exertion, on a lift, you're going to exhale, pull up your pelvic floor, engage your pelvic floor. And then on an inhale or on the return motion, let your pelvic floor muscle relax. And so this is just going to really help with core, right? It's going to help just strengthen the pelvic floor and engage the pelvic floor and just bring more awareness around how our pelvic floor moves, especially with the breath, and just really help with control, hopefully, with some of those moves too.
So exhale and engage the pelvic floor during the exertion. And
During the
then,
lift, during the exertion.
yep. And then during the release, you let go of the pelvic floor.
Mm-hmm. When you
Okay.
take in an inhale and you breathe deep and you inhale, you should feel your pelvic floor drop and lengthen. And it's just as
Mhm.
important to work on relaxing as it is the tightening part.
Sure. I bet everyone who's listening is doing their thing right now. So yes, yes. Okay. So here's the thing. I'm going to reset just for a minute here. So this is Strong Mind, Strong Body. I'm your host, Angie Miller, and I'm talking to Kim Mills, and we're talking about why you pee your pants. Okay, maybe you don't, but you know somebody who does. And how we can take control of kind of some incontinence stuff that might happen from exercise or coffee or just these urges that we get, and how many of them might be mindset or behavioral related. So Kim is an occupational therapist and wellness coach, and she's given us some really, really great tips. So, Kim, a lot of people believe that leakage is just inevitable. It's what happens when we age, or it's what happens after we have kids. Can you dispel maybe one or two of those myths? Let's maybe just take one and talk about it. Is it
Yeah,
true that as we age, we're just going to start peeing our pants?
no, I mean, it's definitely true that our bladder function can change over time,
Yeah.
especially, in response to menopause. Also after childbirth, things change. But these
Yeah.
changes don't mean leakage is normal or that it's untreatable. I've worked with clients in their upper 90s and clients that have had control issues for over 30 years or more, and we've still been able to make an impact and help with their control. So it's definitely treatable. Yeah, it's not a normal part of aging.
Okay. We're not just all going to walk around and need Depends. Okay. So what about post-childbirth life? Like, is that true that every woman after she gives birth, she's just going to pee her pants all the time?
No, no. And I think physicians are doing a better job of teaching clients that are having babies to, work on some pelvic floor strengthening and things like that. I think that's getting a little bit better and a little bit more well known. So my daughter just had a baby herself. So and so we've been really kind of talking about that a lot, but just working on some strengthening. Obviously those muscles get stretched out quite a lot. But yeah, so just really certainly can get things back to normal with some strategies and some exercises.
Okay. So Kim, what causes, like, what are there foods or liquids that exacerbate urges. Like I know coffee for me, the minute I drink coffee, or fizzy drinks like water that is carbonated.
Right.
Is this my imagination or are these things true?
No, they're definite irritants. So, in fact, yeah, caffeine is a big one. Coffee is a big irritant, and that's typically where I start when I have a client is how much coffee are you drinking? And it's amazing how much coffee people consume and wonder why they're having control issues. So, and it can make a big difference to just cut that in half. I never tell anybody to cut their coffee out completely because I wouldn't want somebody to tell me that. But carbonation is another big one. Carbonated beverages, energy drinks, citrus juices can be pretty irritating. And another surprising one really is cranberry juice. A lot of clients drink that regularly to help their bladder, and it does help with bacteria, but it can also irritate the bladder.
Okay. So juices, carbonated drinks, coffee. Are there any foods that are known irritants?
So foods can be irritating, especially if somebody's having painful bladder syndrome. So when I'm working with somebody that's strictly just having control issues, I typically focus more on the fluids and not so much on the foods. I'll give a list of like irritants of foods and fluids, and people are like, oh my gosh, what am I going to be able to eat? So I try to not focus on that too much. If it's just control issues, it's more about the fluids from what I've found. So if it's a painful bladder, it could be more like acidic foods, things like that can cause some issues.
Yeah, I definitely feel like that. I definitely feel like acidic foods. I 100%. So Kim, we kind of talked about like things like the coffee and the irritants, and we talked about like me getting up in the middle of the night and the associations that I'm making in my mind and how to change patterns and habits. Is there any like other really good nugget or takeaway that we could all think about either to break patterns or chains or just kind of behavioral things that we might consider when it comes to leakage or getting better control?
Yeah, so I think just really being aware of your routines and habits and what you're pairing with going to the bathroom. So I like to say, our routines are good for us, right? But they're not necessarily good for our bladder. So just really paying attention to that. Also just paying attention to how your pelvic floor muscle feels. Because what we don't want to do is just send people away with, go out and do a bunch of Kegel exercises, right? Because we don't know what the state of their pelvic floor tone is. It could already be a shortened muscle. It could also be tight. So we wouldn't want to just say, go do a bunch of Kegels. So pay attention to, are you tensing the pelvic floor muscle? Are you kind of gripping down there? Are you holding a lot of stress and anxiety there? And then just really working on some of those relaxation strategies like we talked about with that breathing exercise. And just kind of paying attention to how that feels.
Okay. Yeah. So my other question for you would be if I come to you as a client or you've got a client and they've been managing bladder leakage for years, let's say, and let's say that they even started limiting stuff because they started recognizing like, oh, if I lift heavy, I do this, or if I pound the pavement, I do this. What kind of timeline or results do you think they can expect? I mean, if it's not like a true health condition, a pelvic floor condition, what kind of behavioral implementation strategies can you implement and how soon are they going to see those results?
If it's urgency, if it's urge incontinence and it's really about some of their patterns and their daily habits and triggers and things like that, bladder irritants, we can see results pretty quickly if they really work at it and change some of those things that they're doing, work on some urge suppression. It's really hard to give a timeline. I've seen results where they really start seeing a difference within a couple of weeks. Sometimes it takes longer. If it's more weakness, if it's more about stress incontinence and there needs to be some strengthening going on, as we know, it takes a while to build muscle tissue, right? So that can take a little bit longer. But yeah, it's very variable. And I take a real personalized approach with my clients. So it just really depends on kind of what's going on and how committed they are to getting better. So it's long story short, it's really hard to predict a timeline, but it can be pretty variable.
Well, I imagine your work is a lot like my work. I mean, there's a lot of research that supports that when people come in for counseling, just knowing that they have an appointment set up gives them hope. And I think that we're all like that. If we know that we're addressing an issue, we often will avoid. And that is so much more uncomfortable than finally addressing it, making that appointment and being like, help is on the way. So, so Kim, before we sign off, if any of our listeners want to reach you, what's the best way to reach you?
Yeah, you can reach me on Instagram at Kimmy S. Mills. I have a page on there with some links to a free call, or just feel free to send me a message. That'd be great.
Okay, awesome. So Kim, thank you so much for joining us and talking about bladder leakage, that thing that no one really wants to talk about. And thank you for sharing your guided, very really kind of simple strategies. And thanks to all of our Strong Mind, Strong Body listeners for tuning in. I love hearing from you and we appreciate your support. We'll see you next week.